Afternoon, we have with us Dr. Tapan Sarkar from the intensive care of Bellevue Clinic, Kolkata, and we welcome you to the Natco Pharma Specialty Criticon studio. We look forward to listening to you for your advice to the younger generation doctors in the space of critical care associated with antibacterial resistance. What I'd like to ask you, doctor, is how do you foresee the changes in critical care management?
Critical care management does not only focuses on the antibiotics, but other things are also important, which are vitals. What are the vitals? How the patient is behaving? What is the oxygen level? What is the urine output? And yes, antibiotic definitely plays a role. Now, over these years, these antibiotics pattern has changed. The bugs are also very intelligent, probably more intelligent than the human being. So they are changing there, and the resistance pattern is developing. Also, because of not properly using the antibiotics, the resistant pattern has gone up. Now you will be seeing all sorts of resistance in the scenario. Number one is carbapenem resistant. MRSA was there, Acinetobacter, E. coli. These are the main bugs in the intensive care unit. And nobody exactly knows how to tackle this. We are just playing with the older molecules. Some few molecules has come up, which is encouraging, but we still need a more predictable antibiotic which will work, and that is needed to save life.
I like your point about beyond the view of antibiotics. I like what you said there. So, to the young doctors in the ICU, the current force, so what would you advise them to enhance patient care?
Holistic approach. You have to look the patients in a complete way, not only the infection, but his other things also, and take care of or support every organ which is failing. The more important to prevent the organs from failing. If the organ fails, then you can't do anything about that. So you should be very, you must be practical, you must know what exactly you are dealing with, and you must plan your strategy along with the patient.
What is the prevalence of carbapenem producing bacteria in your practice? You touched upon that some time ago. And what is the best treatment option?
Best treatment nobody knows, only two molecules are available, ceftazidime avibactam, that too with aztreonam. Other is meropenem vaborbactam, but it's not available now. Few companies probably has come out with avibactam. So now they are combining that avibactam with meropenem to counter this situation.
Right. Dr. Sarkar, we thank you so much for your time in the studio and we wish you all the best.